But for the first part of this hour, we're going to talk about a rather important subject, particularly for men, but not just men, because mental health has become a major issue in this country. And of course, mental health for a long, long time had a very serious stigma attached to it, maybe still does to some degree. But more and more people are coming forth who have mental health issues. And we're going to talk about that this morning, particularly as it deals with men. Our guest is a former psychiatrist in the military. He now is with Easterseals MORC. And we say good morning to Dr. Jeffrey Guina. Dr. Guina, good morning.
Good morning.
Thanks for joining us this morning. So, I started out saying, there is, or there was, and there probably still is, a stigma attached to mental health. Is that stigma as serious as it used to be?
Yeah, it's a good question. I think to some degree we've had people being more open to talk about their mental health problems publicly, being more willing to go seek help. I think part of that is driven by media and people being more open. Part of that was during COVID. People kind of had this shared collective stressful experience. And so since everyone was going through something stressful, they were more willing to talk about the stressors related to that and maybe talk about other things as well.
More
so
serious.
We have seen,
yeah, go ahead.
Yeah.
I'm sorry. Go ahead.
So I think we've seen some destigmatization and some openness to talking, but there's still a lot of people out there who are suffering in silence.
Are men more or less willing to come forward?
Men generally are less likely to seek mental health treatment and health treatment in general for all sorts of problems.
Let me ask this question of you, Doctor. At what point does a person need to consult a mental health professional? I ask that for a reason, because I'm of the opinion that all of us at one time in our lives suffer some kind of mental health issue, feel depressed about something, or, we're just in a bad mood, what have you. At what point do we tell ourselves, maybe I need to seek somebody out on this?
Sure. Yeah, it's a good point. We all get sad. We all get angry. We all get anxious. That's just part of the human experience. But the question is, at what point does sadness become a depressive disorder, or anxiety become an anxiety disorder? The answer to that is really has to do with dysfunction. Are those feelings or behaviors impacting your ability to function in daily life, go to school, go to work, have relationships, enjoy activities? And when feelings, thoughts, behaviors are impairing your functioning so much that you can't do the things you need to do to get by, then at that point, I think it's important to get help. But even, preventatively, getting help ahead of time, or just, having someone to talk to can be incredibly helpful. I like to say that psychotherapy isn't just to cure the weary, it's also to strengthen the masterful.
So let me ask about addictions, and there's multiple kinds. There's obviously chemical addictions, drugs, which I don't know if we classify that as a mental health issue or not, or mental health issues may have led to it. But there's addictions for, let's say, gambling. Is that a mental health issue?
Yes. So there's various types of addictive disorders, related to drugs and alcohol and behaviors like gambling. And then there's research now supporting that in the future perhaps there will be disorders related to internet and video games and those sorts of things. But those are definitely could be qualified as mental disorders. They involve thoughts, feelings, behaviors that impair your ability to function, and sometimes they're secondary to other problems like depression and anxiety, and people are trying to numb those emotions out with drugs, alcohol, or behaviors. And for other people, it leads to depression and anxiety, or it kind of becomes a vicious cycle where one is feeding off the other.
Talking to Dr. Jeffrey Guina, Chief Medical Officer of Easterseals MORC. So we're encouraging men, particularly during this month, to get health checkups, physical checkups. And, for example, I have my annual scheduled next week with my primary care physician. Is he going to check me over for mental health problems?
I hope so. I mean, I think because this is becoming such a big problem, especially in the last few years, and because there's more awareness and less stigma, most primary care doctors are screening for and treating mental disorders. In fact, 80% of psychiatric medications are prescribed by primary care doctors, not by psychiatrists. And so I think it is very important that all doctors are asking about this, but I think it's also important that patients bring up what's concerning them or what might be bothering them.
And, if we look at particularly older men and older people, period, dementia in its various forms sets in. Is dementia considered a mental health problem, or is it a disease?
Well, both. I think psychiatrists and neurologists both take care of people who have dementia. And, one of the early signs of dementia, one of the most commonly early signs can be depression. And I think it's very common for people as they get older to be dealing with depression and anxiety, and sometimes not necessarily even realize that that's what's going on. When it comes to isolation or grief and loss and other things that can come with age, it's actually surprises a lot of people that suicide rates go up as people get older. And so that is something that's really important to pay attention to.
That's interesting that suicide rates go up for olders, because we hear a lot about suicide rates in youngsters and younger people.
Yeah.
And suicide is a national problem, isn't it?
Absolutely. Yeah. And suicide rates are going up across all ages and have been for a long time. And particularly, I think, in the last decade or so, some people think that may be related to social media, especially among young people, but also, economic problems, the pandemic, the lockdowns. There's been a lot of things driving suicide rates, and unfortunately, we are seeing that tragically those numbers skyrocket.
Well, Dr. Guina, what particularly we're talking about men's mental health here. What can they do to start the process of taking care of their mental health? Sure.
Well, I think talking about it with the people you trust, talking about what you're going through with family, friends, clergy, can be an important step. Seeking out professional help, whether it be a therapist or a primary care doctor or a psychiatrist, can also be helpful. There's support groups out there, whether it be things like 12-step programs for alcohol and drug problems, or there's just men's support groups or veteran support groups. All of those things can be incredibly helpful. But then there's also just like things that generally taking care of your health. There is no health without mental health, but mental health also depends on physical health. So there's plenty of studies that show that exercise, getting a good night's sleep, healthy eating can be just as effective for depression and anxiety as medications.
Tell us about the online screening.
Sure. At Eastersealsmorc.org, that's Eastersealsmorc.org, we have a free anonymous screening There are several different screenings. You can take a comprehensive one that combines everything, or there's some briefer ones related to depression, anxiety, substance use. And we don't collect any information on that, so it's totally anonymous. And at the end, it gives people some resources, including the Easterseals MORC and in the area, and national resources if people need help.
Last question, Doc. As a former Air Force psychiatrist, how are we doing at taking care of the men and women that come out of the service for their mental health issues?
Well, I think we can always do better. I think, fortunately, more and more people are paying attention than we did historically. So I think there's initiatives with the VA and the federal government and local communities to take better care of veterans. That's something that we do at Easterseals MORC as well. We take care of veterans and their families. There's always room to do better. And I think as we learn more and as we raise more awareness, we can keep doing better to help veterans, whether it be with problems with depression, anxiety, PTSD, substance use, homelessness. All of those things are just so important.
All right. Again, give everybody the online screening address for Easterseals MORC.
Sure. It's Eastersealsmorc.org. That's Easterseals, all one word, MORC.org.
Doc, thanks for being with us today. We appreciate it.
Thank you so much.
Have a great day.